Hi, and welcome to our webinar. We're really excited to talk to Dr. Steve James, who's a critical care consultant who famously challenged the Health Secretary on the COVID vaccine mandates. He's also got a background in meditation and nutrition, breath work, exercise physiology, and he's run a fatigue clinic, and he's recently started the Health Awakening community. Hello, Steve.
Hi, Jess. Hi, Sandra.
So if you could tell us a bit about your background yourself, that would be fantastic, really.
Well, I suppose for most of my career, I was, on the one hand, in the hospital going through all sort of training programs and just sort of doing, the good end of the physiology as far as I could see. Really sick patients, lots of different sorts of bits of kit and monitoring. But then I had this other life, which was being involved with setting up and running a Buddhist meditation charity and teaching meditation. So I sort of had these two things that were separated for a long time. And then with the exercise testing, I got asked to run a clinic looking at patients who had unexplained breathlessness and fatigue, sort of patients who fall between the cardiologists and the respiratory physicians and some neurologists and endocrinologists. And suddenly I found myself having to sort of pull everything together because these patients had a whole variety of problems. They might have presented as breathless or with a chest pain, but there was a lot going on. And that's where I started sort of studying sleep, nutrition. I'd always had an interest in those things myself, but that started then to bring everything together.
So it's more looking at kind of the patient as a whole again. I mean, that's probably a lot more valid really when you're looking at kind of critical care, because you do have to look at the entire body at that point. It can't be specialized. Yeah,
you've got to, it's quite nice going back into sort of slightly more general work with intensive care, because I was doing just sort of cardiac anesthesia before. And so across the whole system, much of hospital medicine has become specialized and super specialized. And so you're looking at, one organ in isolation, but patients don't turn up with their heart on a plate and say something's wrong with it. It's connected to everything else.
And I think my husband's an anaesthetist, so I think I've seen how much that blends really nicely because he knows so much physiology. And I think if you can put that physiology into practical breath work and other things, they connect really nicely, actually. I can see that connection. It's a great way to go.
So what was it that made you start doing that difference? I mean, if you were very mainstream yourself, what made you start doing the Buddhist meditation as well? Was it to help you relax, or?
Well, I started that before I went to university. So I met a Buddhist teacher in a year off when I was traveling, and then invited him when I was at university, to sort of come and visit and do a lecture. And I set up a meditation group when everyone thought meditation was for crazy people. And now you talk about meditation, it's pretty mainstream. But in the early 90s, I was definitely the exception, trying to persuade everyone else that meditation was a great thing to do. I got inspired by Buddhist philosophy, my Buddhist teacher's example, and thought, there's a different way. I mean, there's the essential difference in the Buddhist sort of approach that I was working with is, would you rather put a pair of shoes on or try and carpet the world? So, a lot of time we run around trying to change what's on the outside so that when we experience it, it feels comfortable. But if you know how to wear a pair of shoes, it's just a lot easier.
That's a good analogy. I like it. And how has that helped you, do you think? How do you think meditation helped you cope with stress in your job and other things? Do you think it's made a difference?
Yeah, I mean, I think, most anaesthetists and sort of the cardiac anaesthetists, we're expected to be reasonably unflappable, because you do get into situations which are, quite critical life and death situations. And if you can't think and process just as well then as, when you're drawing up your drugs at the beginning of a case, you're not going to do the job well. So it does filter people out who aren't going to be that sort of well prepared or able to handle things. But I think that I've always seen challenges and stress as something that it's like a wave to ride. So I have always sort of tended to sort of seek out situations that are a bit more stressful to see how I respond under those kind of situations and see, okay, yes, still doing well, still okay, or not, because it's actually quite fun to find out where you make mistakes and where things get difficult. But I do think, though, that you know, understanding and experiencing the feedback from a stressful situation. So when I spoke with Sajid Javid, you know, I could feel my heart racing, but there was this little processing section in my brain going, what you've said is totally fine. Keep on saying this. The longer the conversation goes on, the more impact this can have.
You came across as very reasoned and calm. It was very noticeable, actually. I think that you gave a very reasonable. He actually looked a lot more flustered. He looked flustered, didn't he? Compared. I think actually,
more thought out guard than I was. My boss was behind.
Yeah. So I think maybe if we ask you a little bit about the pandemic, if that's okay, how did the pressure of the pandemic feel in the hospital? How was that? How did you experience that?
There were fantastic aspects and disappointing aspects. I would say the people who were on the ground pulled together fantastically. You know, we were literally, you know, not myself, but you know, some of my other colleagues were setting up new intensive cares day by day, shifting patients one part of a hospital to another. I got drafted in to come and help with intensive care. You know, changing oxygen supplies. There was literally not enough oxygen in the hospital. How it's configured, you could only put patients in a certain bed if they were on this level of oxygen, but not there, because that would then, you know, exhaust the supply. So it was really critical in that sense. But the attitude, I was really impressed with the critical care consultants I was working with. You know, that come together, get the job done, do the right thing was fantastic. The disappointing part was the absence of management and some other colleagues who decided that this was a very dangerous place to be in the hospital because of this nasty virus, and they weren't really there as much as you might expect them to be.
And what about now? I think a lot of people are talking about the ripple effects that they're seeing since the pandemic in healthcare. How do you think that's had an impact on healthcare now?
Well, I think we went for a pretty crazy approach with the degree of lockdown. I mean, you only need to have gone through, you know, half a days of medical sociology training to know that if you lock everybody up in their house for weeks or months on end, you're going to seriously influence their health. And the idea that you restrict the activity and freedom of people who are healthy, asymptomatic, you know, it's crazy. I mean, we've never before, you know, in a pandemic, you isolate those who are sick so they don't spread, and you isolate those who are particularly vulnerable. Yeah. You let the rest get on with things. I mean, I felt, having sort of looked into it in the early stages, okay, I was clearly not susceptible because none of the patients in intensive care looked anything like me as far as their health profile went. I've never seen a single patient with COVID pneumonitis who didn't have a comorbidity. Mm-hmm. And did I feel it was my responsibility to sort of be there and help those people? Well, absolutely, because I was, you know, one of the healthiest people around to do that job, and I was qualified to do that job. And should I try and get natural immunity? Well, yeah. I mean, that would be a good thing. You know, historically, getting natural immunity was the responsibility of the healthy and the you know, the well, so that they could form this pool, and then that reduce transmission to the vulnerable.
I think we decided that as well, really, because I mean, we had a conversation very early on when we saw this coming. And I remember Jessica just looking at us and going, well, you know, we're going to be on the front line. There's nothing we can do. Our patients come near us. I'm a chiropractor. I have to touch patients. I can't get away from that. I'm going to be in their physical space. I can't be 2 meters away from anybody. And so we just looked at it and Jessica went, right, that's it. All sugar out of our diet. Let's increase all the vitamins. Let's get ourselves really healthy, ready for it. Yeah. And the more we did that, and I started telling patients that, they went, really, you improved your health as an approach to this.
I was disappointed that wasn't the message. I
think I was a bit disappointed. We'd never heard of doing that. And I was like, so you saw something coming and you didn't think maybe I should work on my health. Okay.
Well, the nation wasn't given that message.
No, and it was sad, really.
Sickening. I mean, the idea that, you know, the Prime Minister could have been there saying, look, I want you to all really think about what's healthy in life. We all know the foods that aren't good for us. We all know this isn't good for us. We all know exercise and this and that is good for us. Let's do those things as a nation, and let's really improve our health and improve our outcomes from COVID and be a healthier nation afterwards. I mean, it was just such an opportunity it was missed.
I actually think we actually went the opposite way, because I know my patients took home the message of I should stay at home. They tell me I should order food, so therefore I'm clearly going to order Domino's.
Yeah.
I would say the vast majority of people I met, 6-7 months later, they came in, they went, "I need some help. I've put on almost 2 stone.
And their
I've lost
stress
some
levels
exercise."
were so high. With
They're
everything.
actually significantly less healthy after that. And you're like, okay, so let's just start reversing this now. And that's what we're still trying to do with everyone. We've been trying to give them just a little bit of advice, saying, I know they said you can go out for an hour, but let's go out for a little bit more. Let's go and walk, even if you're on your own. Let's go and walk more than that, and just start getting some exercise that way.
Yeah.
And I think someone's commenting in the feed that they
Yeah.
wrote to their MP to ask why they weren't given the message. I think as soon as people realise that, they realise it should have been asked.
Yeah. And it should have been the message, what can we do? And as soon as you start telling people, we were telling our patients, you can do things, they felt empowered and they went, oh, I can actually change this. I can actually do things for my own health. You really can start pushing this and changing.
I think that's what you did when you spoke about it as well.
Yeah.
I think you empowered people, and especially, I'm in a circumstance where my husband's an anaesthetist and that was a difficult situation. But I think also you explained some kind of logic and you used a reasoned approach and evidence behind it. And I think that's what we tried to do with patients as well, is use the evidence and use reason and use logic, just to say, if you work on your health and improve it. And I think from that, bringing in the kind of medicine that we do, that functional medicine, the medicine that you're doing on Health Awakening, it was a really good opportunity to bring that in, because people started to become a little bit more aware of it.
Yeah. So I suppose really what sort of change are you seeing now? So we've gone through it. We're now essentially back to kind of normal care, NHS wise. And so, we're going to have changes.
I mean, the consequences of the lockdown are really increased morbidity and mortality, and we're seeing these excess mortality figures now published by the Office of National Statistics, the ONS, and they're counting still around a third of those excess deaths, at least, as being with COVID. But I haven't seen anybody in hospital dying because of COVID, although I have seen them dying with COVID for a good few months. I mean, I've seen some patients who were at the tail end of a very long period of COVID who have died in the last 6 months, but no one who's been sick from COVID itself.
I think that's what we've observed a lot. And talking to our patients and other people, a lot of the deaths that we saw, those people were ill already and then had COVID on. They just happened to test positive to it. And I think that we've seen a lot more death than we've seen before, actually. I think we're really noticing the impact that it's having, not having their regular GP checkups, not having their regular bloods done, not being, people are much more advanced when they get caught with cancer and other things,
And just waiting lists. I mean, I see it every day. I mean, patients who were taking, 6-7 months to get a hip replacement, we're now looking at 2 years.
And it's stay away from the hospitals. Stay away. Even with COVID, we're being told stay away until you're on your last legs. I mean, the late presentation of people to the hospital, I think, was really negatively impacting their ability to be cared for, especially in the early stages. Patients were ending up very dry, and that meant that they were needed filtration for kidney failure, and there was a much higher incidence of pulmonary embolism. And that sort of late stage presentation would have been better managed if they'd been in hospital, getting hospital care much earlier.
Yeah. I think really there should also be another message going out now to work on health, simply because what I'm seeing, especially kind of like primary and emergency care, is struggling. I mean, ambulances at the moment, it doesn't seem to publicise that much, that you can call an ambulance, but it couldn't take 6 hours to get to
that lady in her garden, wasn't there, or less? But we've experienced that a lot with patients again, that they've been waiting up to hours and hours for ambulances.
And we could still be getting the message saying, let's work on our health, because the NHS is struggling, and we're in summer now. So I mean, everyone knows in winter it's problematic in the NHS. So it's not a crystal ball. You can see this coming.
I'm really quite concerned. It's a real topic on my mind on a daily basis, where people are going to be over winter time with their health, with the fuel bills. There's a lot of pressures coming on to society.
Yeah. I always think this is kind of like a new pandemic that's coming, and that is, it is stress. That's what's going to be coming. I mean, I know during the pandemic ourselves, I was seeing a lot of patients coming in, kind of elderly, I would say, 70s plus, who hadn't really been seeing anybody for a very, very long time. And they were getting a lot of social anxiety. They were coming to see me simply to get some contact. and to kind of talk to you. I mean, they realize, actually, I can touch you, I can treat you. The difference in them, they're like, oh, I just need some sort of contact. Humans, we are quite a pack animal. We do need some help. And they're very nervous going back into it now.
So I think it's a really great lead into, that at the moment, empowering you to take control of your own health is what we do in what we do. And I think with the Health Awakening community that we see that you started just recently, I think maybe tell us a bit about the background of that, if that's okay. Yeah,
sure. So I felt that you have these sort of health awakening moments where you realize, that's how you make a difference. Yeah. And you just get a bit of understanding, a bit of practical experience. For me, the biggest one, I tried to sort of be healthy for many years of my life, but then I read Matthew Walker's book, How to Sleep, or Why We Sleep. Yeah. And I decided, okay, I'm going to give up this 6 hours a night practice that I had. And essentially I've been sleep restricting myself, trying to have more time for the day. And I switched to aiming for sort of 7.5 to 8 hours a night. And it just revolutionized my mood, my ability to do other things, my memory, my learning capacity, loads of things that for me were the weak spots in my capacity got improved enormously. And so once I'd sort of done a few nights of sleeping longer, it was just like, well, that's a game changer. That's really a game changer. I'm not going back to sleeping less again. As you do different things and try those things out, as you gain a bit of trust and confidence, you get this aha moment where you realize, actually it's up to me. And I think there's a very important understanding as to how we relate to the difficulties in society at the moment. Are we on the sort of victim experience of things, where others have done something bad and we're now suffering from that? Or are we able to turn that into a creator experience where we say, okay, the situation here isn't very good. What I want to do now is this. Yeah. And you start to do things, you start to create for yourself, for your local community, the people you have contact with, you start to create something that's better. And that's a really important shift, a really important mindset to have, that you are the one who determines your experience. Like I said, from the example with Buddhism before, yeah. Are you waiting for someone else to carpet the world for you, or are you preparing your own pair of shoes for winter?
I think it's that difference, isn't it, between the conventional healthcare model, which in some ways teaches you that you have an issue, it kind of hits you randomly, and then you go to a doctor and a doctor will then tell you what treatment you need. Whereas it's a different way of looking at it, that before you get to that point, you can listen to your body, you can listen to what it needs, and you can start to try and push it towards health so it can heal, and maybe use that alongside what you have otherwise. But I think it's an empowerment. It's a different level of empowerment.
It's remarkably unscientific, the approach that the medicine takes these days. Just to say there's a problem and now let's just, add something that will try and counteract that problem to a certain extent. And it might also make the rest of the system not work so well. I mean, if you did that in engineering, you'd be out of a job straight away. If you took your car to the mechanic and they simply tried to patch everything the whole time, you would say, but excuse me, it's, why don't you look at the cause of the problem? Yeah? Why don't you change that? And medicine's not doing that.
I think also that medicine now has had enough time to start influencing people. I think people now are starting to see that they're often just taking more and more drugs. And even I've noticed people are saying now, well, I took a drug and then I had a side effect and they gave me another drug. And then I had a side effect and they gave me another drug. And they kind of come in, you can see that they're kind of exactly making what you just said. They're kind of making that kind of awakening where they go, I think I'm just taking loads of drugs. And they kind of go, well, yes, you could try just, fixing what's underneath it. I think in some ways COVID kind of showed this a little bit, because what I saw was people took took the first vaccine, then they had a booster, then they had another booster. And it's a lot of inflammation each time they did that. And I deal with inflammation all day, every day as a chiropractor. And what I started noticing in patients where they kept saying, I'm having this booster and I'm getting really kind of sore after it. I'm like, well, that's because we know it's an inflammatory marker and it will increase it. I suppose, you must have seen that where you were as well, that inflammation is on the rise.
Yeah, well, I think it's been on the rise in society for a long time. I mean, it's sort of one of the key issues, isn't it, behind what we are looking at as healthcare professionals. I think there's a couple of sort of topics that are relating to this sort of drug issue. One is the presentation of science within medical literature. So it's extremely drug company funded. Drug companies run trials that are ridiculous to the layman. So, for example, they'll run a pre-trial. So they'll give everyone the drug, and if you get side effects, then they remove you from the trial, and then they'll run the actual trial without the people who had the side effects. And then, of course, at the end, they'll give it back to everybody, and lo and behold, there's a higher reality side effect profile than there was in the study.
There's also a huge bias, isn't there? There's also a huge bias to what they actually publish.
Yeah, and then there is sort of this replication issue where big studies just can't be replicated, and they just can't produce the results. And I've spoken to people who work for drug companies, and they've left because the way the studies were done, they just said, no, I can't be part of that, because if a bit of not so useful data could be discarded, it was. It's just not the way to do things. And
if you ever want to meet the healthiest demographic of people, though, try and treat a drug rep. Because I'm telling you, they've never taken a drug in their life. They take that job and they go, don't touch drugs. No. They've read all the research and they're so healthy. They're almost always meditation teachers. They're like, they actually have they always go the opposite way. They're like, no, we don't touch those, because they know everything about them.
I think I think it's the bias that we also see in publishing, in which if you go with an alternative medicine study or a plant or based or something that's considered alternative medicine, you're a quarter less likely to get published. Quarter of those get published in comparison. You're 4 times, if you look at a study and they have one from a drug company, if it has a positive result, it's 4 times more likely to be published than a negative result. So we actually start to see that bias shift through, that the negative studies for drugs don't come through, and alternative medicine, a lot of the plant-based things that can be very powerful don't get published. And then there's the randomized controlled trial, which is a whole other topic in, things like acupuncture. How do you randomize control sham acupuncture? And acupuncture is a whole argument from my philosophy, which you go, it's not possible. It's not possible.
On can you do a placebo-controlled acupuncture? So
you just gotta make sure that acupuncturist has no idea that they're doing pretend acupuncture. I'm sure that's easy. Just train them up, pretend that they know what they're doing, but they're not.
But even sham acupuncture, where they put it in different points, probably hits something. So they're probably doing something. And then there's the argument that when you want to do personalized medicine, which is very much part of actually listening to your patient, that's impossible. You can't do a randomized controlled trial, because just the patient intervention of talking to someone and holding that space for someone, I think changes the energy, changes the therapeutic relationship, and you would individualize what you gave them. So then that ruins that as well. It just doesn't work.
Yeah. So when I see patients, I sort of look at 5 different areas for them. I see one is the body, one is the self, the sort of mental, emotional side of things. One is their sort of spiritual unity side, so where they're connecting to purpose, the community, or they're connected to their relationships, and then the influence of nature and the environment on them. So that's, all your circadian rhythms are down here, and they're extremely powerful. One of the things I've always get my patients with fatigue to do is make sure they have at least 10 minutes outside within the first 2 hours of waking, because that sets your circadian clock up for the day. And I tell them, even if you've just got to open the back door and sit with the back door open, start to do that, and that starts to reset the rhythm, and then they start to sleep a little bit better and start to get a bit more energy in the morning, and they notice that they like that daylight, and they increase the daylight. So you've got that, you've got all the relationships, and we know about social isolation, what's gone on with COVID. It's as powerful an influence as depression or cancer on your health. All the body stuff, and there we've got to be joined up between systems. So you've got to be joined up across those 5, but you've also got to be joined up across the systems in the body. And then the emotional, mental side. So that's where sort of my training from Gabor Mate and this compassionate inquiry training comes in, or breath work, to sort of settle things down. And then, when you're working with those, then you can sort of start to look, am I as a human being in the right place? Do I understand my relationship to myself and the world? And ask those bigger questions, actually, that we'd all like to be able to ask and look at in life.
And that's quite a shift. I mean, I of those 5 points, I can immediately think that, you know, 3 of those, most people would just, they wouldn't even try and comprehend the fact that that could make such a big difference to them. The idea, you know, that their mental emotional side has such a big difference. They, you know, that they're in kind of reaction to nature. You start talking about those in medicine, and they're like, really, that has an effect on my health? Yes, it does.
It's free. It's free. Daylight is free.
And that's what the science says. The science says that all those things matter.
Yeah. But you can explain it to anyone who owns a dog and just say, you know, how do you feel when you go for a dog walk? And they go, well, actually, yeah, I feel good. If you've ever had an argument with someone and you go for a walk, and your brain rants it through for the first half, and the second half it goes, well, actually, it probably wasn't as bad as that. And then it's all, by the time you get home, you're like, okay, I've got a full answer now. I was unreasonable before. And it's amazing how that change
outside,
makes a difference.
Walking, you know, exercising has just calmed you down.
If you could just take your shoes and socks off and do it in bare feet at the same time, let's get some grounding in there. Yeah. It's amazing the difference.
And I think maybe a prescription pad should change to that. You know, I think maybe a prescription pad where we gave those things out and prescriptions would be much more helpful.
It would indeed, yeah.
So how do you see this working? You work still in the NHS. Do you think you can integrate these two things? Do you think that you'll stay?
Yeah, I hope so. I'm not entirely sure that I'll stay in the NHS. I'm not entirely sure the NHS will keep me, to be honest, because I do think at some point someone's going to ask questions about the way I want to continue to approach things, because I think there are many more things to challenge.
I hope they do.
I would say more and more look into it, the influence of money and the corporate profit side of things is behind so many things that we've been given, shall we say, in the last 50, 70 years, and they're not benefiting people. I really enjoy the patient interactions on intensive care when you've got the long stay patients, and I've started to sort of try and go in and work with patients with their anxiety in those sort of situations. I also find the discussions with families, especially around end-of-life care, particularly challenging but rewarding, you know, to try and guide a family through the grieving process. I think there's a lot to give there, and I don't know, it's one of those things you never really know what your colleagues are like, how they're doing it, but I feel that I'm on a journey towards improving how I can deliver that to people. So I really enjoy it.
Such a powerful thing to do.
I think communication, though, is one of the best things they could teach anyone. I mean, I spend quite a lot of time teaching my chiropractors that you can treat anyone however you want in terms of actual physical treatment. But if you can be compassionate and communicate well, that makes all the difference in terms of that patient's experience.
Yeah, and the question is, can you do that if you can't do it for yourself? I mean, I think some professionals get what you know, they call compassion fatigue. Yeah, and that's probably because you're trying to be compassionate to others, but not doing enough self-care, and not being kind to yourself at the same time. So I do think that the self-care professional is important.
We lost you there for a moment, just at the end, but we got the gist of that, I think. But I think that's really part of the self-empowerment, isn't it? I think that being able to do healthcare in a way that you can look after your own stress levels, you can look after your food, you can look after your connection with others, nature, all of those things. It's what I think the Health Awakening stuff looks like it's teaching really well. And it sounds like you're doing live classes and other things. Is that right?
Yeah. So it's been a bit of a juggle over the summertime. I was working quite a lot. Got married last week, and yeah, that was fantastic actually. So now it's sort of head down and thinking about things, but I am going to shift the Health Awakening community to a free subscription model. I think our chat last week maybe
we chatted about that.
The right thing to do. So thanks for that. So I'm just looking now for people who can provide yoga, fitness, meditation, breath work. So I'm just talking to some different people. If you've got anyone who you know who would like to contribute to something there, then just ping me their contacts. I think it would be great if everyone in the country could have a free health class every night of the week for no cost. I mean, why can't we as a country put that together. It just seems like
Probably a lot cheaper than all the drugs. It's probably a lot cheaper than all the things that we're doing otherwise.
That's really what we decided. We decided we want to try and help as many people as possible, just to try and shift their health. I mean, that's the answer, really, isn't it? I mean, we have the experience.
It's the most fun to have the most contacts, potentially bring the most benefit into the furthest future.
And create a community of practitioners like us. You know, our aim is also that in America, they've got a little bit more established. They've got the functional medicine doctors all connecting there. But I think here we'd like that same thing. We'd like there to be lots of us that are interested in changing medicine. And I think when more people get interested in it, you can make a bigger change, and then people start asking for it, hopefully, in the NHS, and start demanding it of their doctors.
It's also showing them that we've always been here, because it sounds like we've only just come out of the woodwork, but really it's the fact that, you know, we've just been so busy in practice for so many years. It's now realizing actually we have been here. We're just now trying to get, you know, more visible and show everyone that actually, if you want help, we're here to help you.
Yeah. I think it's a time for a shift in what's offered. So I think that'll go down well over time.
Brilliant. Well, thank you very much for talking to us, Steve. That was fantastic.
Really nice.
Brilliant. Perfect. So that's all we've got time for tonight. So everything, of course, is going to be on thenaturaldoctors.com. So you can tune in anytime you want, and we'll see you next time.